Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss testicular and scrotal pain. Most guys have had pain in their testicles and scrotum at some point. This pain is usually short-lived and goes away on its own. But for some men, the pain does not go away. It persists and begins to affect their day-to-day lives, limiting their activities, destroying their sex lives, and impacting their mental health. What causes this chronic pain in the scrotum? How should it be evaluated? And what treatment options are available? In order to answer these questions, we spoke to Dr. Petar Bajic. Dr. Bajic is a urologist in the Center for Men's Health at the Glickman Urological and Kidney Institute in Cleveland, Ohio. He's also an assistant professor of urology at the Cleveland Clinic, Lerner College of Medicine of the Case Western Reserve University. He specializes in men's health and sexual medicine. Dr. Bajic earned his medical degree from the University of Toledo College of Medicine and then completed his residency training in urology at Loyola University and a fellowship in Andrology and Genitourinary reconstructive surgery at Rush University Medical Center. Dr. Bajic is an avid researcher and a physician scientist. He is also an associate editor for the medical journal Urology and a regular reviewer for multiple other medical journals. And now I bring you our conversation with Dr. Petar Bajic about scrotal and testicular pain. Hello and welcome to the Better Man Clinics. Today we're going to be talking about a very sensitive topic that a lot of men think and worry about, and that's testicular and scrotal pain. Now, most guys have had some pain in their testicles or the scrotum at some point. They don't pay much attention to it, and it usually goes away in a couple of minutes or seconds. But what if the pain doesn't go away? What if it lingers or persists or even gets worse? Then guys start to worry, rightfully so in many situations. They worry about what's causing it. What did I do to cause it? How do I make it better? And the scariest question of all is this something serious? Could it even possibly be cancer? Those are questions that can become very scary really quickly. And they're only made worse by the fact that a lot of doctors don't feel comfortable helping or taking care of this problem. And so that kind of creates a vicious cycle that makes guys pretty miserable and pretty upset, rightfully so. So the purpose of this podcast today is to help better understand testicular pain and scrotal pain. And fortunately, joining us today is an expert in the topic. Dr. Petar Bajic is an assistant professor at the Cleveland Clinic Lerner College of Medicine. He's a urologist and he specializes in sexual medicine and also is an expert on the management of scrotal and testicular pain. Dr. Bajic, welcome to the program.
Thank you so much for having me.
Fantastic, fantastic. So a lot of important information to cover. But before we do, what I like to do just to kind of get started is to really, aside from introducing you and providing your credentials, which we did, what I'd like to know is just to get a chance to know you a little bit better, and particularly what inspired you to go into the path of men's health and help men with this and other similar type of problems.
Sure. So I actually decided that I wanted to do urology even as an undergraduate. And that was kind of coincidentally just based on some of the research that I got involved in engineering that ended up having some urologic applications. So I ultimately gravitated towards that and started my urology training in Chicago, where, as many other major academic centers, we were doing a lot of major cancer surgery. And many of those types of surgeries can have dramatic impacts on quality of life. Okay, specifically in men, we talk about prostate cancer treatment causing erectile dysfunction, urinary incontinence, and things like that. And I felt that although we were doing a good job of helping those men when they came in, there definitely seemed to be an unmet need because a lot of men seem to not really want to bring it up to the doctor. And, because these are kind of intimate problems and maybe they didn't want to make their cancer surgeon feel like they had failed in some way, even though we know that these are
Right.
expected consequences. So it just really spoke to me about a man's tendency to bottle in some of these intimate problems. And then as I kind of ultimately completed my urology training and decided what I wanted to further focus on, men's health was really the area that I was most drawn to because of the need to be able to make men comfortable talking about these kind of things and just trying to increase men's awareness about many of these common conditions that men might experience, and not just in the cancer survivor population, but just across the board.
Mhm.
Erectile dysfunction, prostate enlargement. These are really some of the most common conditions that men might experience. Scrotal pain is another very common condition, and sometimes these symptoms that men may not think are serious might point to something more serious going on. So that's kind of how I got passionate about this area and why I chose to make it basically the entirety of my practice.
Well, that's wonderful, and it's such a significant need that most people don't know about, and that's kind of where we want to a problem we want to solve through this podcast as well. Now, as we dive into the topic of scrotal pain, first we're going to do some basic housekeeping. We're gonna lay what was the word? We're going to set this table here and explain what's the scrotum and the testicles are, right? So
Yeah.
we just want to, just for the guys out there, right? So the scrotum is the sac that carries the testicles, right? Which is different from the testicles themselves, which are the organs in the scrotum that produce sperm and hormones, etc. So just to clear that up, just in case, so that everyone's on the same page. Now, the next bit of housekeeping, this is a really important one. Most of the conversation we're going to be having on this particular episode is about chronic scrotal or testicular pain. But what I want to get off the bat right away is, what are those red flags that men should be thinking about that would tell them this is not a chronic problem? This is an acute emergency that they have to take care of immediately. Can you share some of those with us?
Yeah. So one very concerning thing is if a man has sudden, excruciating testicular pain that just won't seem to let up. This might be an indication that the testicle has actually twisted around itself and has cut off its own blood flow. We call this torsion. It's a very relatively uncommon thing, and it's more likely to happen to young men, teenagers, sometimes even younger, and sometimes men in their 20s, 30s. By the time a man is in his 50s, 60s, it becomes very unlikely that that would happen if it hadn't happened before. So that's one thing. Sudden, severe testicular pain is a reason to seek medical attention. Another thing that would be a reason to seek urgent medical attention is if a man noticed when examining his own testicles a very hard lump or nodule that might be concerning for a possible tumor or something like that. So because of this, I always encourage men to kind of get familiar with what things feel like down there when you're in the shower, do a self-exam, just kind of feel around so that you can tell if there's ever a change, whether that's something new or perhaps just a normal structure that you've always had your whole life.
Mhm.
Those are the two things that I really try to, you know, um, encourage men to be aware of the most as far as red flag type things. And there are many other reasons, that a man might need to go get checked out, but those I would both put as quite urgent.
Perfect. And that's so important because, again, the first thing I want to lay out here is that we really want to draw a bifurcation, right, of what's urgent and needs to be taken care of right away and what we can put in the bucket of chronic testicle or scrotal pain. So putting the urgent topics aside, and thank you for sharing those. If we're talking about chronic testicular pain, there's lots of causes and we'll go into them a little bit later. One thing guys want to know about is prevention. Are they doing something wrong that's causing testicular pain or making testicular pain worse? So the question here would be, are there specific activities that guys may want to be avoiding or even be careful with that could trigger the various causes of testicular pain chronically?
Well, I think one thing that guys should try to avoid, and I think most guys do a good job of avoiding it, is avoiding trauma to the area. Okay.
Sure.
So we're designed to protect this area, which is probably why it hurts so bad when a man gets struck in the scrotum.
Yeah.
As far as other things, I mean, there are so many different causes of what I call scrotal content pain,
Mhm.
which is a little less specific term. We historically have used terms like testicular pain or orcalgia,
Mhm.
meaning pain in the testicle, to basically label any pain down there. And now we know that many of the pains that a man might experience in that scrotal area really have nothing to do with the testicle at all. So I try to use a little more broad term, but there are so many different reasons why a man might experience that, that it's hard to give a blanket recommendation of like what types of behaviors and activities to avoid. In
Mhm.
general, I tell men, if you have a certain activity that seems to make it worse, if
Mhm.
feasible, you should try to avoid that. Okay.
Mhm.
If it hurts, don't do it. And definitely, see a urologist to try to piece apart what might be the cause and how we might be able to reverse that cause.
Got it.
But
Got
certain,
it.
there's general certain things that we as urologists might recommend, like more supportive underwear. If you ask 100 urologists, you don't necessarily always get the same answer because I generally tell guys if it feels good, do it. So if supportive underwear seems to prevent discomfort, wear that. If looser seems better, then stick with that. So kind of got to listen to your body and try to figure out what factors might be contributing. Same thing with activity. If you're doing, Olympic bodybuilding and doing really heavy squats and that's making your pain worse, well, you might need to think about, altering the type of workouts you're doing to try to avoid certain things or maybe focus more on stretching and things like that.
Yeah, I got to tell you, on this podcast, squats are get a bad rap. Let me tell you, every type of pain or problem, the specialist always like, be careful with those squats, right? So it's funny. From we had a hernia expert, a back expert, a knee expert, now a scrotal pain, testicular pain expert. I guess guys, squats, be careful. Is the take home message for that for sure. What about, like, you see online a lot about bicycle riding? Right.
Hmm.
And I know you can't paint everybody with the same brush. As you said, there's different causes, but the idea there is that you're, on the seat, you're compressing your testicles against the seat. It's going to cause chronic pain. What has been your experience with bike riding?
Yeah, great question. We have a lot of great bike trails here in Cleveland. So I get a ton of guys who are really competitive cyclists and things like that. It's a similar kind of advice. If there's a certain seat that seems to be contributing, if you're going on a long bike ride and notice, man, I'm really hurting the next day, you might want to explore alternative types of seats, and they do have some that are specifically designed, to put less pressure on that area. So it's all about working. If you are an avid cyclist, you want to work with experienced shop that kind of has knowledge about these different options that might be available, or do your own research online. Similarly, kind of what I alluded to before, sometimes scrotal content pain might be a referred pain from actually a muscle or even the spine sometimes. And sometimes being in certain positions while riding bike may worsen or exacerbate that. So that's part of the evaluation and trying to identify which things may be contributing, and maybe with physical therapy and things like that, stretching and focusing on certain muscle groups, you might be able to prevent the pains that are associated with whatever type of activity is making it worse. For example, in this case, biking.
Got it. So I think the take-home message is you don't have to limit yourself necessarily, but just in a blanket way saying, "Oh, bike riding bad," or even squats are bad. Although, be careful with those squats. It's just a question of really understanding what's causing it and really focusing on ways to work around
Absolutely.
that. Now,
Absolutely.
a minute ago, you had mentioned supportive versus not supportive underwear. I see a lot online about supportive underwear. This has become a mantra for testicular pain. Can you explain to the guys, like, how supportive underwear, at least theoretically, would help relieve pain?
Yeah. So the testicles aren't just free floating in the scrotal sac. They're actually hanging by cords.
Mhm.
And those cords are made out of arteries, veins, nerves, and muscles. Okay. and the vas deferens, which is what you get cut when you have a vasectomy. That's what the sperm travel through. Now, the testicles actually form inside of the belly when a man is a fetus, and over the course of development, they drop or basically move from the inside of the belly down through the groin into the scrotum. And those cords are what they're hanging by to get their blood supply and nourishment and all of these things that they need for essential functions like sperm and hormone production. As you might imagine, if those things are just hanging 24 hours a day all the time, that may perhaps lead to some strain on some of those structures, or just that gravity itself may be kind of putting additional pressure on whatever the underlying problem might be. Also, if they're kind of hanging, they may be more likely to bump against stuff like your leg or, your seat or whatever is nearby, and that may worsen the problem. So the thought is with supportive underwear is that if you wear something tighter like compression shorts or even tighter fitting briefs rather than boxers, that it may pull the testicles closer to the body and alleviate some of that strain due to gravity and also maybe the propensity to bump against stuff. So this is just one of those things that many of us recommend, at least that patients try to see if it helps with the symptoms. And it's something we commonly also recommend after doing surgeries like vasectomy and things like that, or just to help prevent pain related to those procedures.
Got it. No, that's actually a great explanation. Also, another thing that you hear a lot about is that guys that kind of wear those tight-fitting jeans, that, or like, put a few more notches on the belt than they should, compresses their belly, and that causes pain. Do you see that as well? Is that a common issue?
That's a good question. I could definitely see that. I haven't. That's not something I recently encountered, but definitely, wearing something that's too tight and constricting, first of all, may put pressure on certain muscles and structures that may lead to discomfort. It may also, if it's really tight enough, may affect the way you walk, and that may put strain on certain muscles that may then give you aches and pains in various areas, including the scrotum. So, the bottom line is pay attention to your body and try to identify trends of what might be contributing. And then, if feasible, try to avoid those things, or at least discuss them with your urologist.
Got it. So, with the next segment here I want to cover is just a little bit about home remedies. And, guys don't like to go to the doctor. They like to try to say, hey, you know what, if I can fix this at home, great. So there's a lot of stuff online out there about various home remedies that could potentially work or not work. And I want to get your thoughts on them. The first one, pretty straightforward, Motrin, Tylenol, Advil, just taking the over-the-counter anti-inflammatories or pain medicines. For arthritis, for somebody, somebody tweaks their knee, they take that for a few days, it gets better. So with testicular scrotal pain, are those type of medications also pretty effective, number one? And number two, how long is it reasonable to take those medicines for ongoing scrotal pain?
Okay. So many conditions that cause scrotal pain may relate to inflammation. Okay. Any of the structures that live in the scrotum might become inflamed, or even some of the things that cause referred pain to that area. And referred pain basically means you have a problem somewhere else, but you feel it in another spot, similar to when, you hear of people having a heart attack and it hurts in their shoulder. It doesn't mean there's a problem in their shoulder. We call that a referred pain. So you can actually get those kind of pains in the scrotum. Anyhow, many of these conditions that lead to pain are related to inflammation, and drugs like ibuprofen, Motrin, things like that are anti-inflammatories. So many men might experience an improvement with symptoms when they take those. But even infections, which are caused by bacteria, typically also lead to inflammation. So sometimes, although you're not clearing out the infection, maybe taking a medication like that may provide some temporary relief, but it's not really getting to the root of the problem.
Right.
The bottom line is that some of these things may be well treated with anti-inflammatories, and you need to be careful when you take those, particularly if you have a history of heartburn or ulcers, because these drugs, especially when taken on an empty stomach, can be pretty hard on the stomach. And that's
Mhm.
part of the reason I don't love the idea of men self-medicating with these drugs over prolonged periods of time if they're taking it around the clock, because they might cause some other issues. But I think as a short term as needed, it's very reasonable. And in fact, one of the most common medications that I prescribe, which we'll get more into, I'm sure, later, is a stronger anti-inflammatory called meloxicam, which is
Mhm.
kind of like a long-acting medication that stays in your system for much longer than the over-the-counter stuff does. But it's not uncommon for men to try, a couple days of ibuprofen kind of around the clock to see if that might reduce their symptoms. Tylenol is another good medication that helps with pain, but it's not as much an anti-inflammatory as the ibuprofen is. So that one might not work as well on the inflammatory component.
Got it. Got it. Yeah, and I think that that's such an important point about self-medicating, right? I mean, you take a few Motrin or ibuprofen, and then it becomes a few more, and then it stretches out to days and days and days, and before you know, you've been on this for weeks. And that's kind of like the cautionary tale here, right? You don't want to just become a crutch for not solving an underlying problem.
Right.
The other thing that we hear about, so anytime you injure your knee or your elbow or your back, or sometimes you can put an ice pack on it. Is that something that or the bag of peas, as you say, as we say, does that apply to the scrotum? Would that help, again, short term or long term ice therapy or icing it down?
Yeah, I mean, I think that particularly when things get flared up, a lot of men report that they might use a cold pack. I encourage men not to put ice directly or anything very cold directly on the scrotum, but wrap it in a towel and maybe even through your clothes. You can do that, not for prolonged periods of time, because we don't want to cause any kind of damage. But for comfort, I think it's an okay thing to do. But similarly, it's not going to get rid of necessarily the underlying cause. But if especially if you get hit or something like that, if it's more of an acute pain, that may help it feel better. And
Got it.
and similarly, what you alluded to with the frozen peas, that's a common thing that we recommend after vasectomies and many of these procedures that we do, because it really helps in those setting, which is basically similar to getting kicked. It's kind of an acute trauma.
Right. So maybe for acute issues, but definitely not ongoing, needing to ice down daily.
Yeah.
But on the flip side, one thing I do see a lot online, or you can see a lot online about, is the magic of sitz baths.
Hmm.
You see that every time you see sitz bath, sitz bath, sitz bath. What is a sitz bath? Unless you sit in it, I guess. And what does it do?
I mean, in general, a sitz bath is basically just submerging part of your bottom in water, warm water. It's kind of just like a relaxing partial bath. Some people do it in the tub, just like they would a regular bath. There's even little smaller basin kind of things you can do to just kind of sit in.
Mhm.
But it's similarly, instead of cold with an ice pack, it's kind of an alternative. It's a more of a warm solution that can provide comfort. And similarly, depending on what the cause of the symptoms are, it may help pretty well. If it's, for example, a muscle related issue or strain, sometimes that kind of treatment may really help as far as recovery and things like that. So it all comes back to what is the underlying issue, what are we trying to help, and doing things that feel good and avoiding things that don't feel good.
Makes sense. So it's a lot of common sense here. It makes a lot of sense. So we've tried all this. None of this is working. We're still having this. We don't have any of the red flags, but we're still having this ongoing testicular pain. We reluctantly say, you know what? It's time to see a doctor. Now, the question is, what type of doctor do you see for this problem? Is it always a urologist? Is your primary care doctor? Who's equipped to manage this chronic testicular pain the best, in your opinion?
It's a great and important question, and I don't think it's wrong to just go see who you can. Unfortunately, in this country, we're pretty limited on the number of urologists. We have a great need, and it can be difficult to get in with one.
Mhm.
And not all urologists have a lot of although we all see testicular pain, some might be very specialized in another area, and it just may not be something that they're seeing every day. So it's
Right.
always okay to get, at least get in the door with your primary care doctor, and they'll do an exam and, perhaps order an ultrasound, which is an imaging test that can potentially identify an underlying problem. And then they would determine if you need to be referred to a specialist, who would be a urologist. Now, if you have an established relationship with a urologist and it's easy to get in with them, then by all means, I think that would be also a great place to start. So there's not necessarily an absolute right or wrong answer, but if this is an ongoing issue and you've seen multiple providers and you're just not making progress, then it's probably time to find somebody who's really a specialist in this area, to try to see if there may be another idea as to what might be causing it.
Are there any resources online that you know of that could, like you said, find a specialist in scrotal pain? Like what's a good way to find that online, for instance, or any other resource that you could recommend that guys might be able to find that specialist that they're looking for?
Yeah, that's a really great question. I think off the top of my head, I can't think of one specific place that would be the go-to, but there are a number of different listings of providers through professional associations and things like that. For example, the American Urological Association, I believe, has some sort of provider listing where you can look for urologists in your area. There's the Sexual Medicine Society of North America has a listing of urologists that specifically focus on that area, the majority of whom do see testicular and scrotal pain. And then, the other way is to look at your local health systems and urology groups and just do a little of your own online research. And most of these groups have websites that kind of list their doctors, and you can filter through and try to identify which one may see the diagnosis of scrotal or testicular pain if you're looking for a specialist.
Got it. No, that's very helpful. So as we talked about before, one of the main goals of this podcast is to make guys comfortable with the process. And guys are very nervous about going to a doctor, much less a specialist that they don't know. You mentioned a few things that the primary care doctor may do. Let's say I'm presenting to your office for the first time for a consultation. I have testicular pain or scrotal pain that's not going away. What do I expect in that first visit with you, if you can kind of give us a better understanding?
Sure. And sorry, is this me or is this the primary care doc?
No, you as a specialist.
Okay. So me as a specialist, I may do things a little bit more in depth than, your regular office visit with the primary care or even a general urologist. But the first thing that we're always going to do when you get there is check a urine sample. Okay. And we're going to be checking for any sign of infection or inflammation in the urinary tract. Sometimes we may be able to detect some infection that may actually be related to what's going on in the testicle or in the surrounding structures. So that's why it's important that we check that. If you have any sort of urinary issues along with this, we'll also do a little ultrasound of your bladder after you urinate to see how well you're emptying. If you're not emptying well, there's always a possibility, could there be some urine backing up into the pipes that go down to the testicle and maybe causing some irritation or even bringing bacteria and infection down there. Mm-hmm. We may have you fill out some questionnaires just to get a better idea of your symptoms. And then the next part would be basically talking about the full story of what you've been through, what things help, what things don't, your other medical history, and then doing a physical exam. Now, the physical exam in my office is going to be probably quite a bit more involved than in many others. We'll want to examine the external genitalia, the penis and the testicles, and feeling around and trying to identify where the pain is. I'll check you for any presence of hernias. I'll push on some of the external muscles that sometimes can cause referred pain. I might even push on your back if I think that you might have a kidney stone. And then another part of the exam is called a pelvic floor muscle exam and also a prostate exam. And those are both done by putting a finger in the rectum. Mm-hmm. Now, some men may have prostate related pain. Other men may have problems with the internal muscles of the pelvic floor, which are attachments of the big muscle groups in the legs, the lower back, the hips. The only way to feel those muscles, and we can't feel them like we can feel our external muscles, but the only way I can feel them is with the rectal exam. In addition to that, I'm checking for the tone of the muscles and your ability to relax and contract your external sphincter muscle, which is the one that's important for moving your bowels, but can also relate to the function of some of these internal muscles. So once the exam is done, then we kind of review all the different findings and come up with a game plan. That game plan often might include performing an ultrasound of the scrotum. The other thing that I often do at that initial visit, or perhaps at the second visit, is something called a diagnostic spermatic cord block. This is a nerve block where I actually deliver numbing medicine into that cord that the testicle is hanging from to try to numb up all of the signals that are going back and forth to that testicle. And the reason that I do this is because I'm trying to identify if numbing up that cord makes the pain go away, then that tells me the problem is probably in the testicle. But if I numb up the testicle completely and the pain is still there, that tells me this is more likely to be a referred pain coming from somewhere else. So it helps me identify and understand what's going on. So like I said, this is a lot more involved, and it's because most of the guys I'm seeing have already seen other doctors and had a lot of testing and not been able to find a solution. That's usually why I'm doing all of this stuff. But depending on the story, I might do all or just parts of that extensive workup.
No, that's interesting. So that cord block is not done to treat it per se. It's there to really help you diagnose what the real problem is.
Correct. And the numbing medicine that I use typically lasts for several hours. Rarely I'll have some guys say, you know what, it never quite came back as bad as it was before. I can't really explain that because it's a short acting anesthetic. But one of the possible treatment options, if that works, that I offer to men is actually coming back for a series of those nerve blocks and incorporating some steroid, which is a stronger anti-inflammatory medication. And then by doing that series, that may serve as more of a long-term treatment.
Got it. So if that nerve block is positive, meaning that it helps, you said that's the testicle that's hurting. But what's causing that pain?
So it could be the testicle. Basically, it could be anything that's hanging by that cord below the level of where the block is. So that includes the cord itself, could be the origin of the pain. It could be the vase or maybe a clip that was placed for a vasectomy that's compressing or pushing on some of the nerves in that cord. It could be the epididymis, which is a structure that lives right above the testicle. It might be a cyst that's somewhere on that epididymis. It could be the testicle itself. So unfortunately, we don't often identify what the specific cause is unless the ultrasound or physical exam really shows that one specific thing is abnormal. For example, if I got an ultrasound and the epididymis was very swollen and inflamed and had increased blood flow, that would be consistent with a condition called epididymitis, which is an infection or inflammation of the epididymis. If it doesn't show that, if everything else looks normal on the ultrasound, and if the exam just shows a sensitive testicle or painful testicle when I push on it, or maybe painful epididymis, I don't necessarily always get an exact answer of what the underlying cause is. And in that case, we just kind of have to use the information that we have available and then sequentially go down a list of treatments until something eventually works. But I will say that some of the common reasons that men might get pain are like what I alluded to, maybe post-vasectomy pain syndrome, which can be either due to the inability of the sperm to escape the epididymis and testicle, which causes what we call congestion, which is kind of like almost like swelling that leads to pain, or it can be scarring, or what we call fibrosis of the nerves in the area where the procedure was done. That may or may not be related to a clip or some other part of the procedure that's just kind of pinching a nerve there. Definitely cysts that occur in the epididymis. They're either called epididymal cyst or spermatocele. those are quite common sources of discomfort, or at least sensitivity, because they kind of bump against stuff. Now, those are just collections of sperm. They're not harmful, but they may be a source of discomfort. So those are some of the structures that might be, the signals may be blocked by the spermatic cord block. And I would expect, if those were the cause, that pain related to those would temporarily go away after the nerve block.
Now, one thing that really helps, and one thing that you really help delineate, which is really important, is that you have two buckets, right? When guys come to see you, you have two buckets of guys, if you will. There's the bucket of guys where you find a definite problem, epididymitis, the post-vasectomy swelling, spermatocele, epididymal cyst, varicoceles, which is those varicose veins, etc. Versus the guys where you really, unfortunately or fortunately, don't find anything, and that's when you go down the treatment regimen for things that we can't reverse. You can't do surgery and remove a cyst or whatnot. I'm going to get to that in just one second, but I want to ask one more question of things you can find. How often do you see, if a guy, or statistically speaking, do you see a guy coming in with just testicular pain, and this turns out to be a tumor, a testicular cancer? Because this is the thing that guys come in really worried about. Is this chronic pain a testicular cancer? Can you speak to that a little bit?
Yeah, before we get into that, I just want to make one more comment about the prior statement about whether or not we identify, a structural problem on the workup and whether or not that's the cause of the pain. Very frequently, I see guys who come in with pain who have already had an ultrasound, and the ultrasound shows something like, let's say, a small hydrocele or a small varicocele or even an epididymal cyst. And many of those things can actually be normal findings, or things that many men have who don't have pain, and is likely not the primary cause. For example, a hydrocele is just some fluid around the testicle. Most guys probably have some degree of small hydrocele. Whether or not it's detected on an ultrasound probably varies from day to day. Similarly, a varicocele, which is like varicose veins of the veins in that cord, particularly on the left side, is very common to have a small one, and it almost never affects function in any way or causes pain. Mm-hmm. And then the spermatoceles or epididymal cysts are also exceedingly common. If you examine 100 men, probably at least half of them are going to have one small one they don't even know about. So I try not to get too worked up about some of these findings that I would consider common, unless it very clearly aligns with, on my exam, that specific thing is really where, you squeeze it and the guy's like, "Ow, that is that pain that I'm having at home." So I think that's just an important distinction to make. Now, the pain is rarely the way that testicular cancer presents. Okay, rarely, but not 100%. I mean, you still need to keep that on the list in your mind of that it could be related to a cancer, but usually when testicular cancers show up, they are usually not painful. And the reason for that is because in general, they grow pretty slowly. So it's not a sudden change, and in a lot of ways, your body doesn't necessarily even detect that it's happening to send you that signal of, ouch, this hurts. Now, sometimes a man may get some kind of painful episode related to something else that may be the first reason that he had to feel around down there, and he may notice a mass, and that a lot of times might just be coincidental. So that's part of why I encourage guys to do self-exams and just get an idea of what things feel like down there, and check regularly so that you identify if there's any cause. Because a lot of times, testicular cancer, which is a relatively uncommon condition, but a very relatively common cause of cancer in young men, because young men otherwise aren't commonly getting cancers. That may be the only way to find out that you have it, is just to check yourself.
That's such a good point. And again, going back to what you just said about the fact that things being there doesn't mean that they're the cause of the pain is so important, because guys can get so unbelievably frustrated because they might go to their primary care doctor and get an ultrasound. The doctor says, "Aha, you have a 2 millimeter cyst on your epididymis." And they're like, "Okay, we found the problem." And then they might go to urologist, and the urologist says, this is really not the cause of your problem. And they're like, but it's right there. Versus the cause of their problem might be something from their nerves or their muscles, or it might be, as you said, referred pain from their hip, which is completely unrelated. And this is where guys get really frustrated. So I'm just so glad you brought that up, because it is so important for guys to understand. Just because you find something doesn't mean it's causing your pain, because a lot of guys have it and don't even know about it. So thank you for that. Now let's assume that we are in the camp of maybe we find things, maybe we don't, but there's nothing that we can attribute to this pain, right? And you had mentioned you kind of walk them through an algorithm or a pathway to try to manage that pain. Can you walk us as well through kind of like what your approach, whether that's medications or alternative treatments or even surgery, like how does that progress across your treatment?
Sure. Before we get into that, I think it's worthwhile spending a little bit of time talking about some of the other things we might diagnose that are more like referred pains, because I definitely would want to know about those before proceeding down the whole treatment algorithm. So some of the things that we might find are causing referred testicular pain, one of them is actually, believe it or not, kidney stones. Okay. Mm-hmm. When a kidney stone is passing, particularly when it's stuck somewhere, people might think of pain in their back or what we call the flank, but depending on where it is along the kidney's drainage system, which is called the ureter, as it gets farther down closer to the bladder, it may actually feel like testicular pain. And I actually had a guy recently who was, came to see me for testicular pain, and it was just kind of getting worse and worse, and things weren't working. And we actually got a CAT scan, and he had this huge kidney stone that was totally plugging him up, and now we're taking it out. So it happens. It's not a common reason for guys to present this way, but something we need to keep in the back of our mind, particularly in men that have a strong history of stones or a strong family history of stones, or have blood in the urine, which is another reason that we check the urine test at that first visit. One of the most common causes that I find, particularly in young men, of referred testicular pain is what I referred to earlier, called pelvic floor muscle dysfunction. Mm-hmm. And the way I explain this to men is that the pelvis is like a bowl made out of bones, and then the inside of that bowl is lined with muscles. And these muscles are the attachments of our legs, our big muscle groups in our legs, lower back, and hips. And we can't feel those muscles, okay? It's not like I could say, oh, my left pelvic floor muscle hurts, but they're important for a lot of different functions, okay? And there's different layers of those pelvic floor muscles. They're also the muscles that are important for relaxing when you're supposed to urinate or have a bowel movement. We call those the sphincter muscles. They're also the muscles that encircle the root of the penis on the inside of the body. And when you ejaculate, they spasm and, shoot the semen out. When you try to kind of pulse or strengthen your erection, they're actually squeezing around the base of the penis to try to drive more blood forward. So they have a lot of important functions. They're supposed to relax when they're supposed to relax, and contract when they're supposed to contract. And dysfunction of those muscles can cause a lot of different problems. Right. We're just starting to scratch the surface on this whole concept in men. It's something that we've really come to learn a lot about in work that's been done in women, but the similar concepts apply. Many times referred pain can be coming from these muscles. It's like having a Charlie horse, okay, but you feel it somewhere else. And certain behaviors that a man might do may be kind of exacerbating that problem and making the pain worse. That he may be feeling in his testicle or maybe in his penis. Some of the red flag symptoms that might make me think pelvic floor dysfunction are when the pain is in multiple places. Okay, it kind of moves around. Sometimes it's one side, sometimes it's the other. Or I also get this pain in my inner thigh, or I get pain when I ejaculate. To me, that is pelvic floor dysfunction until proven otherwise, because that is the muscles that are contracting when you're ejaculating. Right. Guys who are very active, like bodybuilders, guys who are completely inactive. Okay, there's a lot of different things, risk factors for having this, and it's one of the most common things that I find. So when I do that rectal exam and I'm pushing on those muscles, that's what I'm checking for. And if you have it, I'm going to send you to pelvic floor physical therapy, which is extremely effective before doing anything else. Okay. So interesting. Other things that may be associated with that I always ask about are any history of lower back pain, sciatica, meaning shooting pains down the backs of the legs, or hip problems, because a lot of times lower back and hip problems can either be the reason for the symptom, or they can cause the pelvic floor problem, which then causes the pain in the testicle. Okay, so I don't do any major, back exam. I'm not an orthopedic doctor, but I have a very low threshold to order x-rays of the lower spine and hips to identify if there's any severe arthritis and things like that. And I've definitely found some guys that had severe spinal stenosis or herniated discs in their lower spine that were really the underlying cause. So that's what I talk, when I'm talking about trying to figure out what's the cause. That's why it's so important, because we can do all this stuff to the scrotum, and if there's some other thing that's causing it to be more sensitive or more painful, until we deal with that, it's just going to be a persistent issue. So now moving on to, let's say none of that is, the case, and we've ruled out all these other things. We think it's a problem in the scrotum. I'll get an ultrasound like we talked about to rule out any structural problems that I might not have been able to detect on the exam. And then one of the things I most commonly will try as a first line treatment is a course of meloxicam, which is an anti-inflammatory, particularly if it's like, it's been going on for a couple months. It's not like it's been there for 10 years. Maybe if we just, reduce whatever the inflammation is that's causing it, maybe it'll go away. And I've had a couple guys that's worked. Okay. If that doesn't work,
can I ask you, sorry, can I interrupt for 1 second? How long do you keep it on the meloxicam for in that situation?
So meloxicam, as just like ibuprofen, can be hard on the stomach and also hard on the kidneys. So I try not to do it for too long. The longest I'll do is about 2 weeks, once a day for 2 weeks, usually 7 to 10 days. I try not to go past the 14 days and I always make sure guys are drinking plenty of water to prevent kidney damage, and also taking it with food to prevent the stomach, acid, heartburn kind of stuff. So if a guy doesn't want to do anything more as far as invasive things like doing a cord block or, some of those other options that we'll get into in a little bit, another medication that I sometimes will use is called amitriptyline. Now, amitriptyline is used as a nerve pain medicine. Okay. It's actually a very old antidepressant when used in high doses, but this is a low dose. It makes it a very effective pain medicine for this type of pain. I'm sorry, nerve pain medicine. So you just take a dose before bedtime. It's a little sedating. So we start with a very low dose taken before bedtime, and after about 2 weeks can bump it up to double the dose. And this works for many men, but it's something that if you were to stop it in the future, the pain would probably come back. It's not, resolving any underlying problem, but it can be used effectively, particularly men that have very chronic scrotal pain. The thought process is that perhaps there's some sort of nerve related issue, maybe a nerve compression or some scar tissue around a nerve or something that's compressing it and causing this type of pain. Now, in general, nerve pain is usually more like a burning kind of sensation, but sometimes even men that have more of a sharp or even achy pain may have some improvement with this. And that's pretty much it as far as medications. I do not prescribe long, opiate medications, or, I'm not a pain medicine, chronic pain specialist in that regard. If folks come to my office looking for that, I usually direct them to pain management. I'm more the guy that's supposed to try to figure out what's the cause, how can we make it go away, so you don't have to rely on pain medications like that long term.
Definitely right.
So we talk about medical treatments. We talk about how a guy responded to that diagnostic spermatic cord block. Usually I'll give them the block, and then I'll have them either call my office or send me a electronic message within the next 24 to 48 hours to report back. Did it make the pain go away? How long did it go away for? And when it came back, how severe was it? And usually guys, if it's effective, they'll say, oh man, it completely was gone for 4 to 6 hours, and then it came back full force. Okay. That tells me that block is, it was effective in doing what it was supposed to do. If that is the case, then I typically will offer guys one of two treatments, besides the medications and things we just discussed. So one treatment option would be a series of nerve blocks with steroid. We just published on this in the Journal of Urology a month or two ago. This is a technique that really hasn't been widely described, that we've had some success with. And what it entails is the same exact type of block, just we add in a little bit of steroid along with it. And we do it once every 2 weeks for a series of 4 injections. Okay. And sometimes add in one or two more at the end if somebody's gotten close but not quite there. Okay. And what we find is that a lot of guys, it'll either make it go away completely or make it much more manageable to a point where it's not really interfering anymore, or perhaps it does nothing at all. An alternative to that series of blocks, maybe somebody is just, deathly afraid of needles or something like that. An alternative to that is something called a microscopic denervation of the spermatic cord. And what that means is a microscopic surgery to cut all of the nerves in that cord that we blocked with the nerve block. If the block worked, that surgery would likely be 90% effective at making the pain go away forever. Okay.
Wow.
That's a very high success rate, and it's most effective in men who have had a block that worked. What we do, it's similar to a varicocele surgery, where we basically make a small opening with you completely asleep. Okay. Maybe just about three centimeters wide. That's about an inch. And then through that, we access that cord, and we basically slowly go through and cut every structure that's not essential. Okay. So that we leave the arteries, which bring blood flow down to the testicle. We leave maybe one vein and a couple lymphatics. And if you're trying to have kids, and have not had a vasectomy, we will leave the vas intact. And we basically cut everything else, because those nerve fibers, we can't really see them all, but they're all ingrained in that cord. And then by cutting that, you basically make the testicle completely numb. So many of my colleagues that don't offer the blocks with steroid may jump sooner to that. I generally offer folks the series of blocks if they want to, particularly if they want to avoid surgery. And we find that some men can avoid surgery with that approach.
Let me pick your brain a little bit here. So we got to unpack some of this. This is great information.
Yeah.
So I got to unpack a little bit for you.
And I apologize for my daughter crying in the background.
I'm surprised my kids aren't running through right now and just photobombing us. So I not a problem at all. First question is, with the blocks, is this a potential long-term solution that you can do this indefinitely, or is this always a setup? If it works, is it always a setup for a potential denervation later on?
That's a great question. So the series of blocks, because it's a newly described technique, we don't really know what the very long-term success is. The experience that we had that we published on that was based on my experience with this technique in fellowship was a relatively, smaller group of guys with not, robust long-term follow-up. But we do think that for many men, this can be a permanent solution. The other thing we don't know is if let's say it works for a couple of years and then the pain comes back, does doing it again give you another 5 years? That we don't know. But we and others are, continuing to explore this and try to understand better what the long-term success rates are and how this may prevent surgery in some men. But in general, the surgery has been well studied at many different centers and shows long-term resolution of these symptoms in large numbers of men.
And so now I need to pick your brain about the surgery a little bit. So first of all, you said it's about an inch cut, but where's the cut made? Is it like made on the testicle? Is it made in the groin? Where's that cut made?
Yeah, so it's not, I always tell guys, it's not gonna be anywhere near the part that hurts. It's actually
there you go.
in the groin area, kind of on the side of the penis. So not on the penis, but next to the penis, in that area, kind of above your sac. That we call it a sub-inguinal incision. So it's basically a small opening right overlying that cord where we can easily bring it out.
Got it. And when you counsel patients about the surgery, what risks do you usually share with them in terms of for the surgery?
So anytime we do any kind of surgery for pain, I always make sure that I'm on the same page with my patient that this may not make it better. And in fact, it may make it worse. Okay, now that's very unlikely, but nothing is ever 100% in medicine, unfortunately. If the block worked, then I think the surgery is the most likely treatment to offer a long-term cure for this condition. But like I said, it's not 100%. Other risks, just like any other surgery, swelling and bruising. Okay. Because the scrotum is very stretchy, sometimes that swelling can become pretty pronounced. Sometimes it can even take weeks, sometimes even months to get better. Now, that's very unlikely, particularly if a guy listens to my advice about activity restriction, which some guys listen better than others.
Yes.
Other things are that a man might develop something called a hydrocele, which, like I mentioned earlier, is a fluid collection around the testicle. That's part of why we try to spare some of the lymphatics to help prevent that. But once again, it's not 100%. The biggest risk is damage to the testicle or the blood supply to the testicle, which might lead to loss of that testicle. Now, that might impact fertility, and it might impact testosterone level. Okay, that's very unlikely. We're very careful, and that's why we use a microscope, and that's why we try to preserve at least the 3 main arteries that supply the testicle with blood. But like I said, there's always a chance that there may be an issue with that. And that's very rare, though. And then there's all the risks just associated with undergoing general anesthesia, which are rare. You know, those include things like heart attack, stroke, blood clots, etc. I mean, those are exceedingly rare, but definitely associated with general anesthesia.
And this is a surgery that people go home from the same day usually?
Correct. It's an outpatient procedure. It takes about 2 hours. You go home the same day. Now, every doc who does this surgery has a little bit different protocols and things like that, but I usually have guys not do any heavy lifting for 2 weeks. Some docs may prefer 4 weeks on that, and then usually the first couple of days I have them mostly laying around, getting up to walk to the bathroom and things like that, get the blood pumping, but otherwise really taking it easy.
And how much pain should they expect to be in immediately after the procedure for the first week, let's say?
It's a great question. Completely unpredictable. I would say the average guy doesn't have much pain at all. Some guys, the pain goes away immediately and they wake up and they're in the least pain they've been in years. Some guys, it can take a while to notice the effects because there may be some pain related to the procedure. So everybody's a little bit different, but I would say the vast majority of guys don't really use any pain pills. I generally try to avoid prescribing narcotics in my practice. I would say the average guy doesn't use any. Some folks may use between 1 and 5 pain pills total. I don't think I've had to give anybody more than 5 pills.
Got it. And as you said before, this procedure, if it works, it's durable, meaning that there's not a big chance of the pain coming back a year later, basically, I'm assuming.
Correct. But nothing's 100%. But, you know, if it's a nerve related problem, we cut the nerves, it's very unlikely that they would grow back and reconnect or anything like that.
Perfect. So just as we're wrapping up, I just want to walk through a couple of these algorithms we talked about. So, you know, obviously we find significant causes of pain like a varicocele might be, or a cyst, we remove it. That's one option. Another option is you're doing an exam, you might find that pelvic floor dysfunction or the signs of that, you might send them to physical therapy because that's the solution for that problem. Right. That's not there. You may do a cord block and you find that it works. And so we find that's that issue, and then denervation, either intermittent blocks or denervations, the answer there. What about the scenario where we're up to that point, but cord block now doesn't work? What do we do then?
Great question. So unfortunately, this is a scenario that does come up. I would say that my practice is definitely try the anti-inflammatory for a couple of weeks. If that doesn't work, discuss the option of being on a long-term nerve pain medicine like amitriptyline and just try to get by with that. Really making sure that we're ruling out any other possible source of referred pain, because if the cord block doesn't work, to me, it is almost for sure referred pain. Mm-hmm. So we're taking a really close look at the spine, the hips, the pelvic floor. Sometimes I'll even send guys to pelvic floor physical therapy, even if their exam is pretty normal, just to rule it out. And I've had at least 1 or 2 guys where even though the exam wasn't that impressive, they learned some stretches, some home, advice for activity modification, and also some home exercise program, and they actually got better. So one of the things about pelvic floor is because we're just starting to understand it, we don't yet know the best ways to measure, whether that's the main issue. I mean, we have some rudimentary ways that we kind of just try to gauge it subjectively based on how tense the muscles feel. Do they hurt? Things like that. So that's generally how I approach it, but it's pretty rare, pretty rare. I would say maybe in my experience, I don't know, 1 in 20, 1 in 10 cases at most that don't respond to the block or that don't have underlying pelvic floor dysfunction. I mean, I think probably half of my patients at least that come in are pelvic floor. So it's an unusual circumstance, but rarely it does occur, and we just try to do the best we can with some of these options that we do have.
Crazy question coming up. Doc, I can't handle it anymore. We've tried everything. Nothing's helping. Can you just cut it out? Can you cut out my testicle? Is that going to help?
Yeah, it's a great question. And this is a question that comes up rarely in the case of a failed microscopic denervation. So let's say, you know, it either helped temporarily, but then it came back, which is a very rare circumstance, or perhaps it didn't help enough. Removal of the testicle, also known as orchiectomy, is an option. There's very limited research that's been done to say how effective it is in this circumstance, and it's a pretty, relative to other treatments, a low chance of success. To me, that means that probably some of those folks that we did remove a testicle on in these research studies that had been historically done, maybe it wasn't a testicle problem, and that's why it didn't work. But I think if the blocks worked and for some reason the cord denervation didn't work, it would definitely be a consideration, but I would probably tell a guy that it's a flip of a coin, 50-50 chance whether it would actually work or not. And then there are also obviously negatives about losing a testicle.
Right.
So it's not something that we just throw around as, you know, a common recommendation, but in rare circumstances, it may be an option. What we don't want to do is remove the testicle and the pain still be there. And I've seen a couple guys recently who were treated elsewhere that's exactly what happened. And sometimes it ends up being a pelvic floor or some other referred issue, and they basically lost a testicle for nothing.
Horrible. Well, it's a sad place to leave off on, but certainly it's a cautionary tale that guys need to be aware of. Dr. Bajic, thank you so much for your time and your fantastic explanations. I think this will be really empowering to a lot of men to understand what their options are. I'm going to leave you with a question that has absolutely nothing to do with scrotal pain that we ask all our experts. As an expert, you have obviously reached a significant level of success in your life, and the name of our program is Better Man Clinics, how to get better, how to reach your best life. What is the secret to your success?
Great question. So I would say just find what you're passionate about, you know, and find the problems that you think need to be solved that haven't been solved, and that'll drive you, you know, and try to also find people that you want to emulate. I think a lot of us in urology really treasure our mentors, and that was definitely the story for me. I feel like my professional life has been a sequence of finding people that I want to be like and then trying to be like them. So I think, you know, find those role models and those mentors and just work hard. And, you know, if you fail, you work twice as hard the next time, and you just keep doing that.
What better advice, right? Follow your passion, get good role models, and persevere. I mean, that pretty much sums it up, right? Dr. Bajic, thank you again so much for your time. We really appreciate it. And for all you guys out there, thank you for watching and listening. And remember our motto here at Better Man Clinics: your best life is a journey and not a destination. And use every day to get just a little bit better. We'll see you all next time.